Triglycerides are a type of lipid or fat found floating around in your blood. When you eat, you ingest more energy than you need right away. The liver converts that excess energy into various forms and stores it inside the cells of the body for later, so that you can access it later when you aren't eating. The body has various forms of energy storage, some better than others. Triglycerides are typically formed when we eat excess carbohydrates, like starches and sugars, than our body can handle. There are a few other reasons that triglycerides may be high. Certain medications can raise levels, and there are a few rare genetic syndromes that raise them independent of dietary composition. But more often than not, high triglycerides are a result of a suboptimal dietary pattern. Thankfully, triglycerides are easy to measure using a simple blood test called a fasting lipid panel. Normal fasting blood triglyceride levels in adults should be under 150 milligrams per deciliter, and the lower the better. They should be less than 75 for children under age 10 and less than 90 for children 11 to 17. Anything above these numbers is abnormal and puts your health at risk. Why do triglycerides matter? High triglycerides typically don't cause any symptoms, but they may contribute to hardening of the arteries or thickening of the artery walls, arteriosclerosis, which increases the risk of stroke, heart attack, and heart disease. High triglycerides may be a sign of metabolic syndrome, something we should all know about. But here's the good news. Triglyceride levels are typically pretty easy to change. Because they are usually a result of recent food intake, changing what you eat should improve them fairly quickly. The foods that typically raise triglycerides are sugars and refined or processed carbohydrates, things like breads, pastas, cereals, crackers, etc. If your triglyceride levels are high, simply reducing the amount of these foods in your diet should lower your levels. Alcohol is also a potent stimulator of triglyceride formation, so drinking less alcohol should also help. Eating healthier fats like olive oil and avocado oil instead of a lot of saturated fats, like those found in red meat and cheese, may also lower your levels. Increasing physical activity is also helpful. Medications can lower numbers too, but keep in mind that they are essentially putting a Band-Aid on the problem, not fixing the underlying problem. Lifestyle improvements are key. Also, keep in mind that changing your diet to lower your levels a few weeks before a blood test may cause your doctor to pat you on the back and congratulate you on having good numbers. But that's not the whole story. Triglycerides are typically a chronic problem. Although very high levels of triglycerides can cause something called pancreatitis, which is a painful and dangerous inflammation of the pancreas, more often than not, the damage they do is slow and methodical.